Well, we have a very special guest in our studio here to talk about the importance of colon cancer screenings.
Dr. Rebecca Osterkamp, welcome back.
Yes.
On Colorectal Cancer Awareness Month.
Yes.
Thank you for coming back. First, I guess we start with that. Can you tell us what colorectal cancer is?
Yeah.
Great, thanks for having me again.
Yeah.
Colorectal cancer is a cancer that starts in your colon and your rectum.
Okay.
The important thing is it starts as a polyp. Every cancer starts as a polyp, but not every polyp turns into a cancer.
Okay.
It's the third leading cause of cancer death in the United States.
Whoa.
Wow, that's so important. What are the best ways to prevent this kind of cancer besides getting a colonoscopy? Because yes, we do need that and we're going to get to it. But what should we be doing besides that?
Well, like all healthy things, I guess the exercise, a healthy diet, low fat, low red meat. Smoking increases your risk of colon cancer. Those are some of the preventative things you can do, but really screening is the best form that we have. And we might talk about it a little later. There are different things you can do for screening that's not a colonoscopy. I would say colonoscopy is the best and remains the gold standard.
Well, let's talk about that because the age has changed. It used to be when you turned 50, it was time to get that colonoscopy. Now it's 45, maybe even sooner if you have a family history. So talk to us about how people should not be afraid to get this test done because first of all, you're asleep during it. So that's what's most important to know. Talk to us about the fears out there.
Yeah, and I see people when they've made it the first step in, but it can be a sensitive topic for patients. I think they're concerned about the sensitive nature of the procedure. We're used to seeing this. We're watching a screen, and inside of your colon.
This is nothing new to you.
Yes.
So don't be embarrassed because Rebecca does this at least 14 times a day. So it's okay, right?
She's well practiced. Yeah,
Yes.
she has some experience here.
Excuse me.
And these screenings are really important. We saw it in that graphic there that this is one of those cancers where the screening can actually prevent it, right? It's not just
because
knowing that you have it.
You take action during the screening. Tell us about that.
Right. So polyp detection is what colonoscopy can do. And as I mentioned, polyps are the precursor to the cancer. And so we can remove those. It's a painless process. You don't feel it.
Wow.
And that's the difference between the other screening modalities where they can detect the polyps, but then you'd still need the colonoscopy to take them out.
Yes.
Gotcha. So
you're in there, you just take them out, and you let the patient come to you and say, hey, we found 2 or 3 polyps, we got them out of there, and now you have a clean bill of health until your next appointment. So when should you get your next one, once you do your original one?
Well, that depends on some of your risk factors, your family history, like you mentioned, or other comorbidities you might have. But if it's a healthy average person with no polyps, it's every 10 years. Once you have a colonoscopy.
Okay, good to know.
Okay. That's not bad at all. So you get a nice little nap, you maybe prevent cancer. It's all just a win-win-win. Doctor, thank you so much for being here this morning. Really appreciate it. Get out, get those screenings. Nothing to be afraid of. More Wake Up Idaho after this.